Hi there, my name is Erica Dinkle and I'm going to be your occupational therapy student today. How are you doing?
Good, how are you?
I'm good. Before we start, I'm going to go ahead and get your first and last name and date of birth.
Sherry Gold, March 15th, 1967.
Perfect. So I hear that you had a fall and you fractured your right radius. How is that going for you? How is recovery so far?
It's a little bit better, still having some pain, especially with like lifting weights or lifting anything heavy. And then quite a bit of pain when I'm putting any weight through my hand.
Okay, we're definitely going to focus on that today and try to get you a little relief in that, so maybe that you can get back to those things that you're wanting to do. Before we begin, on a scale of 0, no pain at all, 10, the most pain you've ever been in, how are you feeling right now?
I'd say about a 4 probably.
Okay, perfect. And if that gets any worse throughout our session, please let me know so we can just stop right where we are, okay?
Okay.
So today we're going to do a sensory assessment, and I'll go a little bit more into that once we get there. And then we're going to do what's called an ultrasound. That's just going to be this little thing going over your skin that's going to kind of release some tension in there and help you relax a little bit. And then we're going to fit you for an orthotic as well, okay? Okay, we are able to go ahead and start with your sensory assessment now. So what this is doing is it's just kind of determining how your sensation is in this hand that you had that fracture in. We just want to make sure that you're able to feel any pain or temperature, anything like that that may be around the hand. So how this is going to work is you can see there's 2 points on this. This is called the 2-point discrimination test. So the 2 points, and if I go on your hand like this, I want you to tell me if you feel 2 or if you feel 1. And we're just gonna go all around your hand. We're gonna start with your unaffected hand first. So your left hand, perfect. And what you'll do is you'll close your eyes in just a second, and then that's when we'll begin. But first I'm just gonna show you what this feels like. Just a little poke, nothing too bad. That is the 2 and this is the 1, okay? So you can go ahead and close your eyes when you're ready. Okay, begin now. 2, 2, 2, 2, 2, 1, 1, 2, 2, 1, 1. Okay, perfect. You can go ahead and open your eyes. That was great. And now we're going to flip your hand over just to make sure that the sensation in your palm is okay too. Go ahead and close your eyes. 2, 2, 1, 1, 2, 2, 1, 1, 1. Okay, perfect. Now we're going to go ahead and do the same thing on the affected arm now. Go ahead and close your eyes. 2, 2, 1, 1, 2, 2, 1, 1, 1, 2. Okay, perfect. Go ahead and flip your arm over and we'll begin again. Close your eyes. 2, 2, 2, 2, 2. 1, 1, 1, 1, 2. Okay, perfect. So it looks like this hand is doing great so far. We only missed 1, so that still means that your sensory is still intact and that we are able to move on now with our modality, which is going to be the ultrasound. Okay, I'm going to keep my frequency at 1. The duty cycle, I'm going to go ahead and change it to 20%. And the warming, I'm going to keep for off. And then I would do this for 3 to 10 minutes, depending on how the patient is feeling. So I'll keep it at 7 minutes for right now, and then see how it's going once we start. Okay, before we begin our ultrasound, I just want to ask you a few questions just to make sure that we can go ahead and move on with the ultrasound, okay?
Okay.
Okay, so are you aware of any cancer at the moment?
No.
Okay. Pregnant at all?
No.
Okay. Cement or plastic in the area of that wrist? I know that you did just have surgery there. That's why we're going to stay away from the heat today, but are you aware of any cement or plastic?
No.
Okay. I'm going to check your skin a little bit just to check for any cuts, anything like that. Have you been made aware of any infections in the area?
No.
Okay. Any poor circulation that you're aware of?
I don't believe so.
Okay. And have you applied any ointment today to the area?
No, I have not.
Okay. A pacemaker?
No.
Okay. And any blood clots?
No.
Okay, perfect. Okay, so now we're going to be doing your ultrasound. The reason why we're doing your ultrasound is just for that area to relax a little bit. Since you did say there's just still that little bit of pain in there, nothing too crazy, but a little. So it'll relax that area. I'm not going to do any heat on it today because of that surgical repair in there. I don't want to heat it up or anything like that. So we're just going to go without heat, and through this you might feel a little bit of tingling, not a lot. Some people just don't even feel anything at all, just relaxation. And there might be a little redness afterwards or during, but that is completely normal, okay? So if at any point it starts not feeling good or anything, just let me know. I'm going to go ahead and clean off the head of the ultrasound. Set this right here. I'm going to put on a little bit of gel on that radial side. We're going to go ahead and start, and I'm just going to do continuous motions of the ultrasound so it's not sitting on your skin at any point. And we'll do this for about 3 to 10 minutes, depending. I have it set on 7 minutes right now, but we can just see how it's feeling. If it feels great, we'll just keep going the whole time. How does that feel?
Feels good?
Good. Any increase of pain or anything?
No.
And like I said, this ultrasound is a great technique just to kind of relax the area and not have any sort of contraction in that muscle or anything like that. Okay, we're going to go ahead and wipe this off. I'll turn off the machine. Use this towel and I'll just wipe this off. Okay, how does it feel?
Good.
Good? Yeah, great. There's no redness, so that means it's working good and it looks great. Okay, we're going to go ahead and do your splint now. The reason we do splints is just to kind of provide a little structure to that fragile wrist, and it helps with stability and kind of a decrease in pain too. So first I'm going to go ahead and show you how to put this on. Go ahead and you're going to undo the straps and you'll just slip your wrist in. Your thumb will go into that hole. And then you will go ahead and strap it up, all three. You want it a little snug, but not too snug. So our general rule is to have this one finger test. So if you can fit one finger under each strap, then that means it's good sizing for you. Okay, well, go ahead and take this off, and I'm gonna let you put it on now. Before we do that, I'm going to explain this. So this is just a little sleeve to put on your arm, similar to a sock. This is just going to help kind of any maybe little redness you could get, rubbing. If you have a little cut on you, it will also help. So you can go ahead and put this on for me. And then while you're putting this on, I'm going to kind of explain cleaning of this. You can go ahead and start putting this on. So for cleaning, you can just use some warm soapy water. You're not going to want hot water though, because this is plastic, so that could cause it to melt or kind of bend a little. So warm water, and then you can get a washcloth and just rub it down. You can also clean these straps off and dry them. And that will be it for cleaning. You'll want to clean just however often you would like, but it can just get a little dirty due to sweating or just being outside, anything like that. And then for storing, like I said, it is plastic, so it can bend and potentially melt. So you don't want to put it near anything too hot. You don't want to keep it in your car, not near your stove or maybe your windows at home. So keep it in a cool, dry space. No pets if they're in the home. You don't want to keep it near them so they don't chew it up. And then I will go ahead and have you take it off now, just so I can kind of see. Once we take it off, I'll explain to you what skin checks are, and I want to make sure that you're able to do that when you're at home. So a skin check is just going to kind of look at the area where it's rubbing, so you can see where in the thumb, you may be able to feel it, where it kind of is touching your skin a little bit. You can check those areas by just checking for redness or any marks that it made. So to me, it looks good, no redness, no marks, so that means it's fitting well. If at any time there is any marks on your hand or if it's hurting you, go ahead and take it off and call us and we'll help you out with that. So we are going to go ahead and wear this every single night. That will just help with the pain in the mornings and throughout the day. And also if you're just relaxing throughout the day, feel free to wear this. I would suggest to wear it. And then if you are completing any activities throughout the day where you're using those fingers, but your arm's a little bit more stable, go ahead and put it on because those fingers still can move quite a bit. Does all of that make sense? Do you have any questions for me?
Sounds good to me, yeah.